Okay, so you're staring at this pile of revision notes, right?
Yeah.
Complex topic. Termination of pregnancy. And you need the key stuff, the high-yield facts, like
Hmm.
now. Well, that's exactly what we're doing in this deep dive.
Yeah.
We're taking your material, the notes you've got, and we're going to really break it down. Pull out the core knowledge. Make it efficient.
Exactly. Think of us as guides through your own notes. We'll navigate it together, point out the absolute must-knows, help connect those dots for you.
Perfect. So let's dive straight in. How does your material actually define this? The basics. Termination of pregnancy or induced abortion. It says it's the deliberate ending of a pregnancy before the fetus could survive outside the uterus. Pretty clear definition.
Concise.
And it immediately mentions the two main ways, right? Medical using drugs and surgical using procedures. We'll get more into those later, I think.
Yeah, definitely. But what's really striking right at the start, from the context in your notes, is the legal side. The 1967 Abortion Act in the UK. And that 1990 amendment. That's the one setting the upper limit. 24 weeks gestation. That legal framework is, well, it's fundamental context, isn't it?
Absolutely. Sets the stage. Okay, so that covers the what. Now, the why. Your notes dig into the etiology, the reasons people seek a termination. And it sounds like it's not simple.
No, definitely not presented that way. The notes really emphasize how complex and deeply personal it often is. It's not usually just one single factor.
So what kind of drivers do your notes highlight? Unplanned pregnancy must be a big one.
Yeah, that's listed prominently, as you'd expect, but also concerns about the mother's health or maybe fetal abnormalities discovered during the pregnancy.
Okay.
And socioeconomic factors play a role too. Financial pressures, lack of support, plus personal or ethical beliefs. It's a whole mix, really.
Right, a combination of things. And building on that, your material also lists risk factors, things that might make someone more likely to be in that situation considering termination.
Yes, and these often point towards sort of external challenges or vulnerabilities.
Like what specifically?
Things like limited access to really effective contraception, or maybe inadequate sex education or resources. Financial constraints are mentioned again. Lack of support systems, whether that's family or partner. And also existing maternal health problems that could make carrying a pregnancy riskier. These factors kind of highlight wider systemic issues sometimes.
Got it. So we've looked at the definition, the why. Now let's shift to the how, the pathophysiology. Your notes touch on the mechanisms involved.
Yeah, they break it down clearly into the two main approaches we mentioned. For medical termination, it's about specific drugs.
Mifepristone and misoprostol.
Those are the ones. The notes explain they work by inducing uterine contractions, basically telling the body to expel the pregnancy.
Okay, that makes sense. And the surgical side, how does that work according to your notes?
Surgical methods are about physical removal. So procedures like vacuum aspiration, sometimes called MVA, or DNC dilation and curettage. The mechanism is direct removal of the uterine contents. And as your notes imply later, the choice between medical and surgical often comes down to how many weeks pregnant someone is.
Which brings us neatly to the big picture, the numbers, the epidemiology. This is where your notes get really specific with UK stats. Super important for revision.
Absolutely. And the headline figure from your material is pretty striking. It says about 1 in 4 pregnancies in the UK ends in induced abortion.
1 in 4. Wow, that really puts it into perspective.
It does. It shows how common this is.
And you've got that specific 2018 data for England and Wales in your notes.
Exactly. Let's look at those numbers. It shows 200,608 abortions for residents that year. Add in non-residents, and it's 205,295 total.
Okay.
The overall rate was 17.4 per 1,000 resident women aged 15-44. And your notes flagged that rate was actually up 4% from 2017, so a slight increase then.
Interesting. And there were trends within those age groups too.
Yes, the notes highlight a couple of key trends. Rates went down for women under 18, which is, potentially good news, but they actually rose for women over 35. So maybe shifts in demographics or life circumstances. And another really crucial point for practice, the timing. Nearly all abortions, 9 out of 10, happened early.
Early meaning?
Your notes specify 71% were under 10 weeks, and the vast majority, like 90%, were within the first 13 weeks. That's very early gestation.
Got it. And the notes even mention specific reasons within those stats, like risk of handicap.
Yes, it pulls out that figure. 3,269 abortions in that data set were carried out under Ground E, which relates to substantial risk of the child being seriously handicapped.
Okay. And funding that's mentioned too.
It is a key point. Nearly all abortions in England and Wales are funded by the NHS, even if they're physically carried out in the independent sector, which many are.
Right.
Your notes also give the Scotland figure for 2017, 12,212. And importantly, mention the recent change in Northern Ireland, abortion being decriminalized there, bringing it in line with the rest of the UK's legal framework. All really high-yield points from your sources.
Definitely good facts to have clear. Okay, let's switch gears to the clinical side. If someone is seeking or having a termination, how might they present? What do your notes say?
Well, the presentation can vary quite a bit, depends on the method chosen, medical or surgical, and also the gestation.
Makes sense.
But common things your notes mention would be vaginal bleeding, some abdominal cramping like period pain, maybe stronger, and potentially passing blood clots or pregnancy tissue. These are the expected physical signs afterwards.
Okay. And before anything happens, what investigations are typically done based on your revision material?
The essentials are covered. First, obviously confirming there is a pregnancy, usually a urine test, maybe a blood test like a beta HCG.
Standard stuff.
Yep. And then, crucially, determining the gestational age. How many weeks pregnant? That's usually done with an ultrasound scan.
And why is that so critical?
Because the gestation really dictates the options available, which methods are suitable and safe, plus the legal limit. The notes also mention assessing the woman's general medical history and health, making sure the chosen procedure is safe for her specifically.
Right, safety first. So once it's all confirmed and assessed, how is the termination actually managed in the UK system? What's the process described in your notes?
The key thing your material emphasizes is that it's very regulated by law, by national guidelines like from NICES or the RCOG.
Okay.
The process involves several steps. Counseling is vital. Discussing all the options in your notes stress this includes continuing the pregnancy. It's not just about termination.
So informed choice.
Exactly. Explaining the risks, the benefits of the specific procedure being considered, and then, of course, getting formal informed consent.
And then the actual procedure takes place.
Yes. The specific method, whether it's the medical route with pills or a surgical procedure, is chosen based primarily on that gestational age we talked about, but also the patient's preference and their medical history, all within that legal 24-week framework.
Okay, clear process. Now let's look ahead. Prognosis. The likely outcome. Your material seems pretty positive on this.
Generally, yes. When the procedure is done safely by trained professionals and within the legal regulations, the notes state the prognosis is good. Physical recovery is usually straightforward.
But complications can happen.
They can. The notes are clear that complications are rare, but they're possible, and it's important to know what they are. This is definitely high yield for revision.
So what specifics do the notes give? Any rates mentioned?
Yes, and knowing these rough rates is useful. The most common complication listed is infection. Your notes say potentially up to 10%. Cervical trauma or injury is mentioned as rare, maybe 1%.
Okay. And more serious things.
Less common, but more severe ones include significant bleeding or hemorrhage. The notes give a range, maybe 1 in 1,000 up to 4 in 1,000 procedures. Uterine perforation, where an instrument makes a hole in the uterus, is similarly rare, 1 to 4 in 1,000. And failed termination, where the pregnancy continues, is less than 1%.
Those specific rates are definitely key takeaways from the notes.
Absolutely.
Now, your material also seems to tackle some common worries or myths about long-term effects.
It does, yeah. It directly addresses a few things. It states clearly there's no robust evidence linking having an abortion to an increased risk of developing breast cancer later on.
Okay, that's important.
Nor is there clear evidence linking it to future preterm delivery and subsequent pregnancies or to infertility. Your notes specifically say the evidence isn't there for those links.
Good to have that clarified based on the material.
Yeah.
What about psychological effects? That comes up a lot in discussions. How do your notes frame that?
It's presented quite carefully, reflecting the complexity. The notes say that, yes, a small proportion of women might experience negative long-term psychological effects.
Okay.
And that feeling distressed soon after is common, but often that distress is linked to symptoms or difficulties the woman was already experiencing before the abortion.
Right, so it's not necessarily caused by the abortion itself.
Exactly. And crucially, the notes state that the evidence suggests having a termination is not more likely to cause poor mental health outcomes compared to actually continuing an unwanted or difficult pregnancy. That's a really significant point from your sources.
That is significant, a nuanced picture.
Very. And there's one final point your notes make in this section, which is also critical. It mentions that denying women access to legal abortion services can actually have serious negative impacts on both their physical and mental health.
So it highlights the importance of safe, legal access from a health perspective based on the material.
Precisely. It frames access as a health issue.
Okay, wow. So we've really gone through it, taken your revision notes piece by piece and done that deep dive. We've covered the definition, the why, etiology, and risk factors, the how pathophysiology of medical and surgical methods.
The epidemiology, those key UK stats and trends, the clinical presentation and investigations, how it's managed within the UK system, the generally good prognosis, but also those specific complication rates.
And we tackled those points about long-term physical and psychological effects, drawing directly on what your notes say.
Yeah, we've tried to pull out the absolute key facts, the figures, the legal points, all straight from your material. The goal was making it high yield, easy to digest for your revision. Things like knowing that 24-week limit, the 1 in 4 statistic, the main complication rates, the evidence on mental health, that's the solid foundation.
So as you think back over this deep dive into your own notes, what really sticks with you? Maybe a particular statistic or that legal context, or perhaps the details on complications or the psychological aspect?
It's definitely worth reflecting on how all these different pieces fit together, isn't it? The law, the numbers, the actual medical process, the potential outcomes, how they form the complete picture presented in the material you've gathered.
We really hope this has been helpful, a useful way to cut through the complexity and get to the core of this important topic as laid out in your notes. Especially if you're revising for something like the MSRA, this kind of focus breakdown is crucial. And speaking of the MSRA, if that is your target, remember there are more resources out there. Do check out pastthemsra.com.
And freemsra.com as well. Lots of helpful stuff there.
Definitely worth a look. Well, thanks for joining us for this deep dive.